Right, so next we'll be talking about the next couple of podcasts, the 2026 Universal Definition of Heart Failure that came out recently in AHA/ACC, ESC, and World Heart Federation. Second Universal Definition of Heart Failure previously was 2021. So it's essentially going to be the skeleton for the next full AHA/ACC heart failure guidelines that are expected to come out in late 2027. So there's 5 changes. So there's going to be 5 subsequent podcasts, 3 minutes each. However, this one's an introduction to kind of go through each of them. There's a new cause classification. There's now standardized ways to classify the underlying cause of someone's heart failure and not just the syndrome itself. And it's essentially built to make trial and registry data comparable across institutions. EF categories got looser, not stricter. So the old LVEF cutoffs are essentially replaced by 3 broad categories. Previously, it was heart failure with mildly reduced ejection fraction from 40 to 50%. Now there's only 3 categories. Essentially, 50% is the middle ground. Anything less than that is heart failure with reduced ejection fraction. Anything greater or equal to 50% is heart failure with preserved ejection fraction and HFpEF. If you previously had heart failure with reduced ejection fraction and it got improved, that's classified as HFIMPEF. Number 3, heavier weight on stage A and B. So essentially, patients at risk for heart failure or pre-heart failure, stage A and B respectively, have more weight. So people who are at risk to support earlier intervention before progression to advanced disease and before patient presents with typical heart failure symptoms. Number 4, heart failure is framed as reversible, not just progressive. So essentially, they hone on the condition is now explicitly described as dynamic with real potential for improvement or remission rather than a one-way diagnosis. And number 5, social and geographical drivers are also kind of baked into the definition and really honed on in the article. So access to care, social drivers of health, and geography are written in that framework. So takeaways, HFrEF or heart failure with reduced ejection fraction and HFpEF still exist, but now they sit inside a bigger cause plus stage plus trajectory framework, not just the EF cutoff. So kind of looking at the bigger picture, the underlying cause and the trajectory of the heart failure itself. And stage B or pre-heart failure is the one to watch. This is the one that they really honed on in the new classification, and essentially putting its attention to stage B in the next few years, kind of seeing the underlying cause and the risk factors that patients have for progressive of heart failure. So over the next couple podcasts, we'll be talking about the 5 major changes that we just went under, and kind of explaining the differences between the first universal definition and looking forward to the guidelines that land in late 2027.